Over the last few years, Saskatchewan has experienced alarming spikes in the number of HIV cases. In fact, in 2009, their rates were comparable to those in Nigeria, and Saskatchewan continues to have the highest rates in Canada, a situation that worries Dr. Ryan Meili.
For decades, we were among the lowest rates of HIV in the country. And then we had an increase in new cases, the peak of which was around 2009, 2010. They'd come down somewhat, but we're still at over 10 new cases per 100,000 people per year, where the national average is just over 5. So we're still around twice as much as the national average. We've seen something happen in Saskatchewan that is really uncommon in the developed world. We've made some progress. We're seeing less mother-to-child transmission. We've had none for the last several years, but we're still seeing lots of people in hospital and young people actually dying from AIDS.
In 2012, Saskatchewan saw 17 cases of HIV per 100,000 people. By comparison, Ontario had 5.1 cases.
What happened? We got an increase in intravenous drug use, and then HIV got into the population that was using drugs and sharing needles and soon began to spread very quickly. We do have high levels of poverty, high levels of social marginalization, in particular among the population that was most affected, which was the Indigenous population, First Nations and Métis people.
Dr. Meili explains that Saskatchewan was somewhat caught off guard by the spike.
We had traditionally not had high rates of HIV in this population, and so nobody necessarily knew that this was about to happen. Although, if you look back, you see that there was a spike in our hepatitis C rates just a couple of years before this, and that's often a precursor of a spike in HIV rates.
In order to prevent new spikes, the province has to address social determinants of health.
There are also other things that were not prevented that could have been, but are difficult to do. One is, how do you create the conditions for good health so that people aren't likely to become addicted to drugs? So better distribution of income, better availability of housing, levels of education, etc. Once you have that situation of high levels of drug use, what are the pieces that can help with prevention?
Saskatchewan's neighboring province, British Columbia, has had an impressive track record in reducing the spread of HIV and AIDS. Between 1994 and 2013, the number of AIDS cases in BC decreased by 88%. How did BC achieve this?
And so one of the keys in British Columbia to their success was very early introduction of HIV treatment free for anyone who's HIV positive. Expensive drugs, but far more expensive to have people either getting very sick and winding up in hospital or spreading the illness. So they took that as an investment and a wise investment, but they also did a lot of important work around testing, prevention, and treatment, and early treatment in particular.
Cost is not the only barrier to treatment. Access to medication is an issue in many parts of Canada.
It's great if the medications are covered, but if you live on reserve or in a rural community where there isn't access to providers, then all the free medications in the world don't do you any good.
The Joint United Nations Program on HIV/AIDS has proposed a 90-90-90 target for 2020. The goal? They want to diagnose 90% of the world's population, get 90% of those on treatment, and ensure that 90% of those diagnosed become fully virally suppressed.
When people are virally suppressed like that, they're really not able to transmit the virus to others. It's an ambitious target, but it's thought to be the level at which HIV would be greatly diminished in its transmission and that really AIDS would be almost unknown.
However, Canada has not signed on to this model.
Is prejudice behind the refusal of Canada to get behind 90-90-90? I would say probably not an anti-HIV prejudice, but perhaps some views around drug use and addiction that are not particularly helpful. That people should simply stop using drugs and smarten up, but not a reality for most people. So those who are stuck using drugs, we need to still find a way to not have them die because of that activity.
But even if there is still a lot of work to be done, Dr. Meili believes that an AIDS and HIV-free generation is possible.
I believe that is something that we will look back on one day and think, wow, the early 2000s were crazy. Thank goodness we took this goal on seriously and got things under control. The matter is, do we have the political will to make that decision now? Because the longer we wait, the harder it is. The further it's spread, the more people have been damaged, the more difficult it is to respond.
For Evidence Network, I'm Mélanie Meloche-Holubowski.